Welcome, everyone. Thank you for taking the time to join us today. My name is James Threatte, and I am the director of Drummond's ONC-Authorized Test Lab. Today, we'll be discussing HTI-4 and providing you with information about the new rule as well as future rules. Also joining me today are Brenda Millett and Eric Herrera, both of whom are account managers and proctors on the Drummond ATL team. Before we begin, I'd like to inform you that there will be a live question and answer period at the end of the webinar. If you have any questions, feel free to share them via the webinar chat. This webinar will be recorded and posted to our website, and we remain available to answer any other questions that you have via email. Let's get started with Brenda to talk about an overview.
Great. Thanks, James. Thank you, everyone, for joining us. As James mentioned, we're here today to talk to you about the HTI-4 Final Rule and some of its highlights, and what it means for developers who participate in the ONC Health IT certification program. The HTI-4 Final Rule finalizes certain proposals from the HTI-2 proposed rule that was introduced back in August of 2024, specifically electronic prescribing, real-time prescription benefit checking, and electronic prior authorization. Some of those proposals or policy initiatives that were introduced in HTI-2 really are the core foundation for the HTI-4 final rule and become the foundation or the groundwork for future rulemaking, which James will dive into in just a little bit. And you may have noticed that it intersects quite nicely with the fiscal year 2026 CMS IPPS final rule. And that might have been done intentionally. And we'll take a little deeper dive into that too. So the HTI-4 final rule becomes effective next week, October 1st, 2025. ONC-ASTP really took the broader CMS IPPS final rule. They took advantage of some of the CMS policy initiatives that were introduced in that final rule to advance some of the policy initiatives that were introduced in the HTI-2 proposed rule, which really gave birth to the HTI-4 final rule. Again, introducing or finalizing some of the proposals that were introduced in HTI-4, specifically electronic prior authorization, real-time benefit checking, and electronic prescribing, specifically moving forward or advancing and becoming the vehicle for moving forth some of the policy initiatives, specifically the ability to reduce clinician burden, specifically with electronic prior authorization, the administrative burden for a procedure that has been cumbersome for quite some time, electronic prior auth, which has been a manual process for so long for both providers, payers, and frustrating for patients. Also, improving patients' ability to receive timely, affordable care through real-time benefit checking and facilitating health information exchange. So who is impacted? Both health IT developers and healthcare providers. Healthcare IT developers, and Eric's going to take a few minutes to go through in just a moment how it affects health IT developers specifically and what new criteria were introduced in the HTI-4 final rule. But health IT developers must update to new certification criteria, specifically those health IT modules that are certified to electronic prescribing must update to the latest NCPDP script 2023-011. And those health IT modules certified to electronic prescribing may also be required to certify to real-time prescription benefit checking, and may also possibly be required to certify to electronic prior authorization APIs. And healthcare providers, those using certified health IT software and participating in Medicare programs such as promoting interoperability and MIPS, must ensure that they have the required software and standards and framework in order to perform at least one electronic prior authorization in year 2027. And James will go into more detail about that in just a minute too. So at this point, I'll turn things over to Eric and he'll talk to you about the new criteria.
Okay. Yeah. Thank you, Brenda. Next, I want to talk about the new and revised criteria that were affected with the HTI-4 Final Rule. First updates that we'll talk about are in the electronic prescribing space. So the ONC ASTP did revise the B3 electronic prescribing criteria. They set an expiration date of the end of 2027 for the current and existing 2017-071 script. So developers can choose to certify to either the new or the old script up until the end of 2027. But in order to remain compliant with the program moving into 2028 and beyond, developers would need to adhere and implement to the NCPDP script 2023-011 standard. The ONC ASTP did make updates that focus on priority functionalities within the electronic prescribing space. And because of this, they removed many of the previously optional transactions that were available for certification. One of those optional certification transactions was electronic prior authorization, with burden reduction being a primary focus with HTI-4 and new administration. The new script standard does require support for electronic prior authorization of medications, as well as the new script does enhance medication history and other previous functionalities, which overall create faster and more accurate prescription workflows to benefit providers and patients. Since there are some pretty significant upgrades between the 2017 script and the 2023 script, all new and existing certifications will be required to live test with your account manager to certify to the new script standard. Because of the overhaul as well, there will be a new ERX test tool that will be available for certification post the effective date. The new script test tool for ERX e-prescribing is currently out for beta testing. It's been available since the beginning of June. I believe that the window for beta testing is during the weekdays, 7 a.m. to 7 p.m. Central. So if you're interested in getting ahead of the curve and want to take a look at that and participating in the beta testing, let us know. We can provide links to the Google group, which has the new test tool available to those interested developers. The next update in the electronic prescribing space is a new certification criteria that is based on the NCPDP Real-Time Prescription Benefit Standard version 13. This new B4 real-time prescription benefit criteria does support providers to access patient-specific out-of-pocket costs and coverage information for those prescription drugs, vaccines, and Medicare Part D covered medical supplies that a provider may order. This, as Brenda alluded to earlier, as well as does allow patients to address affordability issues at a time the product is prescribed to them by providing them with transparency of cost of suitable alternative products that they can use, as well as providing transparency of prescription costs at different pharmacies that they could potentially use as well. The main takeaway here for B4 is that it will be added to the base EHR definition on and after January 1st, 2028, as well as it will be a requirement for certification for those product listings that are certified to the B3 electronic prescribing criteria. Next, I want to talk about electronic prior authorization. So these are some new FHIR-based certification criteria that ONC-ASTP did pass with the HTI-4 Final Rule that again focuses on reducing administrative burden for providers. This is also ONC's ASTP's way of aligning with CMS's prior authorization API requirements that are required for MIPS eligible providers who are going to need to attest yes to requesting a prior authorization electronically for at least one medical item or service, which does exclude drugs during the 2027 calendar year. And these criteria will be a way for providers to take care of those. They did add in 3 new criteria, which align with the 3 implementation guides for the provider prior authorization API criterion. And this allows flexibility for developers who are wishing to only support a part of the full stack of the electronic prior auth workflows. So the first implementation guide in the criteria is G31, Coverage Requirements Discovery, otherwise known as CRD. And this essentially just defines a workflow to allow healthcare providers to request information from payers about the coverage requirements for the patients. And this takes advantage of CDS hooks to integrate with provider workflows with payer decision support. The next criterion is Sheet 32, Documentation Templates and Rules, otherwise known as DTR. This provides a mechanism to navigate and quickly assemble the information needed to support a prior authorization request according to a payer's requirements. Typically, we utilize an EHR's FHIR API. And the last certification criteria and implementation guide is Prior Authorization Report Support, otherwise known as PAS. This enables direct submission of prior authorization requests, as well as supports follow-up tasks such as checking the status of previously submitted requests. typically uses things like fire bundles and attachments, as well as new subscriptions modular capability that we will talk about next. So next slide, please. The HTI-4 Final Rule does also add in 2 new modular API capabilities that are fire-based, and these do support the electronic prior authorization workflows, but they do have other use cases that may be a benefit to providers in the real world. The first criterion is J20. This is workflow triggers for DSI. Essentially, this enables clinical decision support tasks through an API utilizing CDS hooks to allow decision support results to be integrated into your provider's EHR workflow. This is otherwise referred to as payer coverage at order sign. And because this is, as I mentioned, a part of the CRD G31 coverage requirements discovery and workflows, certification to J20 would be required if a developer is certifying to G31. The other modular capability is J20 subscription. This enables the user or system to be proactively notified by a server or particular event or data update of interest. This, in other words, is a receipt by the EHR of a notification coming from the payer side within our EPA workflow, letting know that they can process those prior authorization requests. This is a part of the PAS, prior authorization support workflow. So if a developer is certified to G33, you would need to certify to J21 as a dependency criteria. Okay, next slide, please. Okay, with the variety of new criteria and revisions to e-prescribing, their ONC-ACP did release some draft test procedures that are currently available for comment. They've been available for comment for some time now, and that comment period does close tomorrow, Wednesday, September 24th. So if you're interested in reviewing those and providing feedback, please let us know. We can provide you with links to those. But within those draft test procedures, there are placeholders for relevant test tools that would be required for each of the certification testing components and criteria. The fire-based criteria, which are the EPA workflows and the modular capabilities, will utilize Inferno. There are currently draft test kits in Inferno available for just pre-testing. There's test kits for all 3 of the EPA stacks, CRD, PTR, and PAS, as well as there is also a draft test kit for the subscription J21 module criteria as well. As we mentioned, these are all just draft. ONC-ACP will likely be releasing finalized test tools and their test procedures at or around the effective date next week of October 1st. But obviously, we recommend developers to closely monitor the ONC-ACP's announcements for any updates to the timeline and documentation that they may provide. Okay, so next I will pass it over to James.
Thank you, Eric and Brenda. So talking about the timeline for HTI-4, effective date next week, as we discussed, in 2026 is when Drummond Group expects to begin certification testing of these G and J criteria, as well as the e-prescribe. This will allow time for the test tools and test procedure to come out, for questions and clarifications to be addressed, and we'll be supporting those criteria internally next year. Next, January 1st, 2027. So there are, as part of the CMS rule, there are certain payers that must support electronic prior authorization. These payers are Medicare Advantage, Medicaid, CHIP, and qualified health systems on federally facilitated exchanges. On top of that, in calendar year 2027, providers are required to use electronic prior authorization APIs at least one time during the year. Then in January 2028, the base EHR definition changes to include B4. B3 is not listed as base EHR, but because B4 depends on B3, it's also going to be required. All right, so ONC has tipped their cards a little bit. The HTI-2 proposed rule last year has resulted in 3 final rules so far, with HTI-4 focused on prior authorization. The original proposed rule included, in my count, 19 different fire implementation guides, of which this is only a handful. There has recently been an initiative with CMS to advance what they call the health tech ecosystem. And ONC is working closely with CMS to advance that, as we saw with the CMS IPPS rule, which included HTI-4 at the end. There are 4 additional fire implementation guides being added to the regs to be, quote, for use by HHS. These are all affecting payers and support for those implementation guides to provide patients, providers, information that they need. So those 4 fire implementation guides are Karen, which is claims and encounters data. There's PDEX, which is a patient access, plus it's used for many other things. Then there is also PlanNet, provider directory, and drug formulary. So useful, but not required by anybody yet. And CMS is looking at new rules to include those implementation guides in the future, but has added them to the regs to be referenced for later use. Also, we think HTI-5 is coming soon. There was a post on LinkedIn recently with a link to an announcement of a rule that will do all the following things: codify parts or all of the enforcement discretion guidance. There's been a handful of new enforcement discretions. For real world testing, we'll talk about how that is not going away because the new G and J criteria are requiring real world testing. So the enforcement discretion did remove the requirement for health IT developers to submit real world test plans this November. However, products that are certified on the API criteria G7, 9, and 10 will be required to submit real world testing results in February of 2026. The way that the enforcement discretion was written, it's just that the ACBs and ONC will not enforce developers to submit or to create real world test plans and results. They are still expected to do real world testing. They're just not needing to submit it. All right. So it's important to note that until the rule is changed, developers are still required to perform real world testing. They'll just need to submit the results for API criteria only next February. We expect real world test plans to be due next year and going forward as well. They're also looking to remove certain certification criteria. No idea what that could be, but in keeping with the deregulatory nature, we could look and see the A criteria, even D criteria changed or removed. Also, condition and maintenance of certification requirements, as well as other certification program requirements. And that could be literally anything. And then there's also, they mentioned potential deregulatory actions on information blocking and TEFCA. I mentioned that HTI-2 proposed rule resulted in 3 final rules so far, 2 of which were information blocking and TEFCA. So it wouldn't be unheard of to deregulate policies that were implemented not very long ago, but let's hope that it doesn't create additional confusion amongst the health IT industry. Currently, the Drummond Test Lab is meeting with the customers to discuss these changes as well as the others. The HTI-1 upcoming deadline is December 1st. What you have or things that you want to address, we are available to meet. There are lots of little details coming out with questions about how to actually implement them. So we would be happy to discuss that with you. We can share actionable insights across the entire industry and clarify roles and resources and identify support gaps. So Drummond wants to be your compliance partner and support our customers maintain their compliance and as well as promote interoperability. We are launching some initiatives about PDSI and FHIR clients and semantic interoperability with the Fireplace program. So all of which combines into this rule and the changes that are coming up that we see in the healthcare industry. So please reach out to your account manager and schedule a meeting, and we'd be happy to meet with you and discuss these details with your entire team. Okay, Q&A. All right, so if we're working with a certified relied software for ERX, do we need to test this? Okay, yeah. So the Chapel ID will require the B4 criterion. And so it depends on if your third party is certifying B3, B4, or if B3, B4 is on your product's Chapel listing. If it's on your Chapel listing, then you'll be able to create your base EHR CMS ID. If you are using modular products to do that, you would combine the e-prescribing software with your certification to create the CMS ID. Brenda, Eric, anything to add there?
No, I think you hit it. Yeah.
And Melissa and I have a check-in call, so we'll chat about that.
Okay. Yes, B3, B4 will be live tested, all of which. And products that are currently certified on B3 will need to come back and test the B3 because there is such a significant change in the functionality that only a live test will do. And once he told us attestation will not be an option there.
Yeah. In the draft test procedure for V4, they call out the ERX tool. So again, as we mentioned earlier, there's beta testing for that new tool, likely B4 real-time prescription benefit would be one of those components within the ERX tool.
All right. As my understanding, CMS isn't requiring use of the EPA APIs. They're just recommending. So yeah, that's true. The EPA APIs, so G31, 32, 33, were not added to base EHR. Health IT developers are not going to be required to get some certification on those criteria, but providers are going to be required to use them. The requirement is for providers to use the API, but not for Health ID developers to certify it as of yet. Yeah, real world testing requirements for non-API modules. So until the regs are changed, real world testing is still on the books for all of the affected criteria. The enforcement discretion simply makes it so that you're not required to submit results for non-API modules. Again, ONC is expecting developers to still do real world testing. They're just not required to submit their data. So it's more of it's an honor system, extra credit kind of thing.
And there was one more that she was asking to clarify about B3 and B4 live testing. Yes, both B3 and B4 would be live tested. That's all the questions. So
that's all of our questions. Great. Also, we are meeting with all of our customers one-on-one. So if you have other questions, we can meet later this week or next week. Let's go. Well, thank you all for attending. Thank you, Eric and Brenda. We are very excited about these changes and looking forward to watching the evolution of the certification program 15 years down the line. Thank you and look forward to hearing from you.